Unfortunately, multiple myeloma is an active area of research, and this research has led to the development of a number of effective new therapies over the last number of years. And with these effective therapies, patients are living longer and healthier lives. With these newer treatments available, the question comes up whether older treatments, particularly autologous stem cell transplant, is still important in management of myeloma patients. And there have been a number of recent clinical trials that are aiming to answer this question. The individual studies differ in how they were conducted, but the general principle is that a large group of newly diagnosed multiple myeloma patients are enrolled, and they are randomly assigned to one of two treatments. The first treatment mirrors what is the current standard in myeloma, which is giving chemotherapy followed by an autologous stem cell transplant. The other group receives chemotherapy alone, using a combination of these newer effective therapies. And these groups are followed over time to see whether one treatment may be better than the other. From these studies, a few themes arise. The first is that for patients who have a transplant as part of their care, we tend to see deeper remissions, which means that by the end of treatment, there's less evidence of the myeloma compared to those who do not have a transplant. Secondly, patients who have a transplant on average have longer remissions. So the time between finishing their first treatment and having a need for a second treatment is on average longer. The final question is whether patients who have an autologous stem cell transplant live longer than those who do not. And this has been a difficult question to answer, largely because the patients who do not have a transplant on the clinical study often do have a transplant afterwards, which makes this a difficult question to answer. But from this data and from other data from earlier studies, the major international and national guidelines in terms of how to manage myeloma do suggest using autologous stem cell transplant as part of treatment for patients who are eligible. It's important to remember that this is a more intensive therapy and is not appropriate for all myeloma patients, particularly older patients or patients who have other health problems where the transplant may have significant risk of side effects. Thankfully, for these patients, chemotherapy alone can still be very effective. So when it comes to any individual myeloma patient and whether transplant is right for them, it's really best to speak with your myeloma doctor.